If I'm gonna go to work and I'm gonna do something, I'm gonna do it well. I'm gonna make sure that each patient is like how I would want my family member to be treated.
Were your child, your parent, or your loved one in the bed, what would you be able to do? And you can't do it by yourself.
We're working with the team, and everybody kind of gets it, that it's a team process.
Sometimes you're the support person, and sometimes you need support, and your coworkers and your team members give that to you. And hopefully at another time when they're feeling that way, I can give it back to them.
It's satisfaction for you, for the patient, and the team as a whole.
And when you work well together, things shine more.
I work in the emergency room. It's very busy all the time. It's very fast-paced. Patients come in with a lot of complex diagnoses, and it's easy to get caught up in little things, but when you are primarily focused on the patient, you're constantly thinking, what does the patient need?
The patients, they become part of your family. I mean, we spend long hours here and take great pride in what we do. And following up on a patient, checking in on a patient, you may not be taking care of that patient today, but you stop by just to see how's Johnny doing today? Like, Johnny's not the patient. Johnny's the one who had a test in school yesterday.
A lot of us check in from home. We text or call a colleague and say, how is baby in 722 doing?
You have to love people because you're dealing with everybody, whether you take care of a sick baby or a new mom or an adult.
And then as well as taking care of the family. I mean, it's such a big part of pediatric nursing, taking care of the parents and the siblings, or the siblings that have been in the hospital for a week.
And the families expect that as well. They look for the staff and they look for the person that's caring for them to be able to follow up.
We could all agree that that's why we love being pediatric nurses, is that you want to make kids happy. You want to take the best care of them that you possibly can. You want to put a smile on their face.
They're still trying to be playful, and you are playful with them, so it kind of makes it a better environment. It makes it a happy environment. I mean, there are times where things can get rough, and that's where you do everything to make sure that they're still a kid. When they have to go to a procedure, teach them about the procedure in kid terms.
Little things matter, and that's a really big deal. And they will remember that little thing forever. Oh, you're the nurse who did that for me.
When you're having a bad day or you're like, how do I do it? You look at the patient. You say, how are they doing it?
The biggest reward is obviously when the patient goes home, but I think the bigger reward is when they come back to visit.
People go home, they're well, they keep in touch with us, they tell us that we make an impact, that we've done something for their family. And that's the best feeling of all.
I think when you're making a difference in people's lives, that's like the best feeling that you could get. We're making a difference in people's lives every day. That's really powerful.